Well, if we had as a mission statement and pass that statement to our children, that every morning we're doing jog of 10 or 15 kilometers as a routine, and every evening we're going and swimming a mile or two, and this on the regular basis, I think we wouldn't have that much of problem of growing in sizes. The best medication will not help, and best advice will not help if there is no fundamental changes in behavior. If our life consists only on working and eating, basically that our purpose of life is to have a supper and heavy supper, I think we missed something fundamental in our life. Key success to the change and to become a little bit slimmer is to dissociate fact of or need for food with something different. Eat when you're hungry. Eat because you have to survive. That's it. The simplest advice is increase on activity, because that will help as well as with general health and decrease on stress. So increase on activity and stop focusing on the only pleasure that they could imagine, which is food. These days we're having on-the-go coffee in the morning, if any, something in the car during the ride to the workplace, small lunch and big dinner. I advise to my patients, have a breakfast like a king, take lunch with your friend, and give up your supper. I had working the time in one of the small hospitals in Johannesburg. I had a group of young people preparing for Paralympics, and they approached me with simple question how they could improve their performance, not by means of using steroids or anabolic steroids. So the next things that I came up as proposal is to use of human growth hormone, HGH, injectable, at that time quite expensive but effective. Consecutively to those group of young people who, by the way, done quite well after the treatment, we put on trial entire staff of that clinic. Nearly all nursing staff passed through the trial group using growth hormone, and you can imagine that those people who are working 12 hours a day shift and not necessarily that motivated by just the fact of losing weight, we had very, very good results.